Okay, it looks like we're live, so I'm just going to go ahead and get us kicked off. That was actually the first time that I've actually moved through that a lot faster than usual. So anyways, good morning, everyone. Happy Monday to you. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and I am happy to welcome you back onto our live broadcasts. Today's live broadcast, of course, is with the mayor. So before we delve into some of the updates that he has, you know, I like to give you some housekeeping that you should be aware of by now. So if you've heard it before, please feel free to tune me out. And if you have not, then just lean in closer and listen. If this is your first time on our Facebook page, we are also streaming this on our YouTube channel, Westminster Chamber of Commerce. Make sure that you are connected with us on those platforms by liking the pages, by hitting the follow button so you can get those timely alerts when we do go live or post fresh content. Often we get asked where we share additional information, and most of the time you can find that on our other platforms. We are on Instagram and Twitter at Westy Chamber, and of course on LinkedIn, Westminster Chamber of Commerce. Finally, but not lastly, westminsterchamber.biz is where you can find a lot of information where we link resources from our city, from our county, and of course state and federal level. So as you're hopping onto this broadcast, please do me the favor by hitting the like button or start commenting so I know who you are that's tuned in and I can give you some shout outs. I already see Tara with us. I see Elazar and I see Tiffany. Thank you guys for hopping on. Dave Carpenter has quickly hopped on to share a quick happy Monday to us and good morning to us both. And of course, Wayne Anderson has shared a no. It looks like he's tuned in from our YouTube channel, sharing a good morning message to both the mayor and I. Now, these comment section is designed for you to engage with us. This is where you can post any comments that you might have, any compliments. If you have any questions on any of the information that the mayor shares, or maybe he does not touch on a topic that you were curious about, please type that into the comment section of this broadcast. It's our way, after he has shared with us some updates, that I can pull that up and get those questions or comments addressed to you. We like being as interactive with you as possible, so please be sure to engage with us along the way. Now, without further ado, you know that I have Mayor Atchison here with us on a weekly basis. He's providing us updates on what's going on in our community around COVID and other information that's pertinent and relevant for us to know. Mayor, I'll mute myself. It's yours.
All right. Good morning, Juliette, and good morning, everyone. We appreciate somebody joining Juliette and I every Monday morning, so we don't feel like we're talking to just ourselves. To Dave and Wayne, thanks for guys popping on. I'm surprised Parker's not here yet. We're going to talk a little bit about COVID and a couple of other things, but some of what I'm going to give you in this first part, I'm going to read it verbatim from the information I have so I don't miscue it. The acronym CALPO is a piece you're going to hear a little bit about this morning. And CALPO stands for the Colorado Association of Local Public Health Officials. They recently wrote a letter to CDPHE, the Colorado Department of Public Health and Environment. So I'm going to read their statement, and then they'll tie in here in a minute. CALPO is made up of local public health officials serving the 7-county Denver metro area. That includes Tri-County Health Departments Adams, Arapahoe, and Douglas counties, along with Boulder, Broomfield, Denver, and Jefferson counties. In the letter, which was sent to CDPHE on Thursday, November the 6th, CALPO said that delaying protocol on the COVID-19 dial could reduce the value of additional restrictions. While we appreciate the latitude and additional timing that CDPHE has provided to counties whose metrics exceed their level on the dial, we are concerned that with the steep acceleration of cases and hospitalizations, these delays will reduce the value of the additional restrictions provided in the higher level, essentially rendering them too little, too late. And that's a quote out of the public health piece that comes out of Jefferson County. I picked that up this morning. One of the things too, over the weekend, as late as yesterday and last night, I had some calls and conversations with the governor. And yesterday afternoon, we were asked to provide information on a public release for a press conference through the governor's office. And this is the statement that was included from Westminster. The city of Westminster is doing all it can to stop the third wave of COVID-19, which is why we've launched a health ambassador education program in partnership with Tri-County Health Department, says Westminster Mayor Herb Atchison. Special teams are safely canvassing neighborhoods to ensure residents have the most up-to-date information about COVID-19 and support services available. We're also asking city staff to return to telecommuting if they can. We hope other businesses will take similar action where possible, because together we can stop the spread and protect our families, friends, schools, and local economies. Now, this is an update on the ambassador program was set up to assist the Tri-County Health Department contact people and businesses on the importance of complying with the health guidelines. The volunteers are working off shift from their normal jobs at the city and are being paid by CARES dollars through Adams County. This was part of the IGA recently approved by City Council on a split vote, as not all council supported this action. I want to stop there for a second and talk a little bit about where we're at. In our health numbers, as of 10 o'clock this morning, Adams County is at 1,257.2. That's our 2-week infection rate, with a positivity rate of 16.2. Jefferson County is at 840 for the same period of time, with an 11.9 positivity rate. Keep in mind, the stay-at-home level is 350. We have been well over 350 for more than a month, and our numbers have not slowed. Now, I interact with 4 different hospital groups on a weekly basis, being Health One, Centura, Avista, and SCL. 2 of those hospitals last week were on a non-transfer basis. That means that nobody in another hospital area could transfer patients to them because they were full. One of them was down to 20% of hospital beds left throughout the entire hospital. Other hospitals in the metro area are also starting to see the inability to transfer patients. And some hospitals have seen people waiting in emergency rooms from 12 to 18 hours while they tried to search for beds for them. These are items that are continuing to be an issue throughout our healthcare system. As many of you are aware, we have a surge site that's one of 3 in the metro area, one of them being in Westminster. Again, in our conversations last week with CDPHE and to the hospital there, what they're projecting to open that hospital facility to get the equipment, get it clean, get it functional, ready to go, is a 2 to 4 week process. The important part of this is that, unfortunately, even if you open the facility, we can't staff it. Hospitals across the board, every hospital group in the entire state of Colorado is on an employee shortage for healthcare workers, nurses, doctors, all levels of people who deal with healthcare. We have a national shortage in the same way. So groups that would have potentially been able to come here to help us staff and man these surge facilities simply are not available. So the importance of us trying to protect everyone, regardless of who they are, where they are, is compounded by the fact that we have a very big national shortage of healthcare personnel. So we want to continue to work this issue with all of you. And as we've talked about, the importance of these test sites and stuff. Now, we still have the test site, which is a large capacity site at Waterworld. The Westminster City staff is working today with the Jefferson County staff to consider opening up another test site that would be west of I-25. right now there aren't any large test sites other than Waterworld. So we're looking at potentially opening up one in the Westminster's downtown area, and would be also asking that the county look at opening up a second one toward the southern part of the county, likely in Lakewood. So those discussions have started today. We meet with the Tri-County Health Group, I do, every Thursday. Starting this week, we are going to start meeting with Jefferson County. After several requests, they have finally decided to schedule one where all the mayors of Jefferson County and our city managers meet with them to talk about what's going on, what actions are being taken. With the continued increase in numbers, I don't know why the health department hasn't taken more action. But even in the action that they take, if people don't comply, it does us no good. As we have told both health departments, we will look at this ambassadorship program for either one of them, but do not, and I think this is consistent with most every mayor that I know of in the area, do not ask us to send police officers out for enforcement. We are not going to do that. We have to have enforcement. If it's going to come in, it's got to come from the health department. But the pieces where we can help in offloading some of their staff to go out and do those checks and do the verifications is up to them. I believe that there are CARES dollars available in both counties to help pay for this additional staff, if they can find them. That's going to be an issue with both counties, because healthcare workers for the hospitals and the care facilities and nursing homes, clinics, wherever, is still a short supply. And how they would use those people, it would be up to them. We have got to continue to work together. And as I told Juliet, two of our biggest contributors are still our large and small groups. We just finished one challenge with Halloween. And guess what? Next week we have another one. We have got to try to help each other. We have got to be consistent in our application of staying home and staying safe. Get your testing. If you think you've been exposed, get tested. And one of the things that wasn't on COVID that we talked about was that last week in the city council meeting, we took the vote on the final version of the Standing Lake IGA. The last group to vote on the Standing Lake IGA will be the city of Thornton, who will be taking final action on this tomorrow night. Again, this IGA limits the risk for Westminster for full responsibility to only 54% of any issues occurring from any incident of a contamination of the lake water. Without this final IGA, Westminster could have been held liable for all incurred costs for all three cities with no limit on financial obligation. This does mean that boats will not be returning to the lake in the future unless at some point all three cities agree to reopen the discussion. The objective of this IGA is to protect the water of all three cities, currently at about 300,000 residents. Again, a split vote from Westminster, as some felt that the boats were a priority for them and commitments that they had made to the boating community. I'm sorry, I don't agree with that. Our water is our lifeblood of this city and the people who use it. And I'm sorry that boats can't be returning, but we cannot guarantee with any level of certainty that the mussels that are controlled and brought in by those boats could not return. Nor can we guarantee that something else won't happen to that level. Up until we get this IGA, as I said, we were 100% accountable for anything that happened to the water supply of not only Westminster, but Thornton and North Glen. The cost to us would have been insurmountable. We were talking in the tens of millions of dollars on an annual basis if anything had happened. At least now we have sharing of responsibility. But don't misunderstand that the opportunity to open this discussion could come if there's ever found to be some way, if the mussels were to get into the system or something else could get into the system, that we couldn't revisit that in the future. But again, as I indicated previously, that between our partners in the storage area, Thornton and North Glen both, The return of boats to the lake was a non-starter in the negotiation. And I know not everybody agreed with it from City of Westminster, but in my opinion, and the majority of council, that was the right decision. Juliet, we're about halfway in, and our COVID numbers, again, are growing. We are continuing to ask the public in the businesses where I have visited. I have seen Westminster continues to be a good supporter of mask wearing, even to the point you're seeing today go into effect. Walmart is limiting the number of people who can go into a store. And Costco, who had previously allowed people who indicated they had a health issue with wearing a mask, are no longer allowing them in unless they wear a face shield. Those two groups went into effect today. Please do everything you can. I don't want to lose one job. I don't want to lose one business. And God forbid, I don't want to lose one person. I lost two good friends this past week. Unfortunately, neither were COVID, but a 60-year-old man and a 48-year-old man. These were long-term friends here in Westminster that I lost. I don't want to lose anybody, whether I know them or not, to this COVID. And we are a long ways away. Very good information coming out of Washington about a couple of potential vaccines. But by the time we get those, when you have one that has to be stored in such a cold temperature, how can you distribute it? I have not heard any indication of how they think they're going to distribute that across the country. The new one that came out today shows it has a 95% effective rate. But again, we don't know about distribution, storage, and we don't know how often those are going to be reported. This is great information coming out, but the proof is in the pudding about when we get the actual approval that we can start to produce this in large quantities and start to get it out. We've seen the priority of the people who they expect to get the vaccines first. A lot of us are going to wait till the end, and it could be a year or more before some of us get to the vaccine. In the meantime, we still have the flu epidemic that's starting. If you haven't got vaccinated, please do so. If you have an issue with it, I understand. I truly respect your decision whether or not you can take this vaccine, but do whatever you can to protect your family and your friends, and especially with these upcoming holidays when so many families want to be together. Think about what could happen if somebody comes in and is infected. All right, Juliet, let's see what we got.
Well, no questions, believe it or not. We've got a couple of comments and we have several people that hopped on here. So I just want to quickly give some morning kudos to them. Deandra, I see Chris Pacey, good morning to you. And Chris Maloney, Robin, Yvette, Daniel. Hopefully you can not hear gargle, Daniel, so let me know if it's working better today. Alan, Danielle Hicks. I also see Larry Godwin and Counselor Scully is on here with us and several other folks. So if I have skipped you over, my apologies. Make sure that you comment either a comment that you might have or a question for us to get to. The quick message that we had from Danielle was a quick good morning note. I know right after you had shared the creation of future testing sites, or you all are looking into potential future testing sites here in the downtown and possibly down in Lakewood. Danielle did comment quickly and said, great, that's some good feedback for her to know as well. Counselor Scully, of course, is sharing a quick good morning our way. Thank you, Counselor Scully. And it looks like Richard Chamberlain has also enjoyed this broadcast today. If you guys are just now tuning in, our mayor, within that 15 minutes, really shared a wealth of information our way, from COVID numbers to recent letters of advocacy that were made out to the Colorado Public Health Department. We also touched a little bit about recent hearings and then votes that had transpired in City Council related to the IGA in Stanley Lake, and several other items that we've included into the comment section of this broadcast for you. I try and do as best as I can to capture some of the information, but the mayor does provide a lot of data and detail, so make sure that you always rewind and rewatch, especially when it pertains to numbers. Mayor, I know you shared about the site that's at Waterworld, the prospective sites that are coming. We still have the uninsured site that's available for folks as well, right?
Correct.
Okay.
It's down at the max, still on a daily basis from 8 to 4, I think is the number.
Excellent. And I know you just shared some updates on two of our larger retailers in the area, Walmart being one, and Costco as well, as it relates to mask wearing and usage, even if you may have a potential mental health or other problem that was disallowing you from participating in wearing your mask. I know several of those grocery stores have started also changing their hours. Do you know of any outside of, I know Walmart has changed it to now 10 o'clock is their cutoff time. Are we aware of any other grocery establishments that are doing the same thing, Mayor?
Not other than those that are affected by the public health orders, or restaurants, bars and stuff that they have the 10 o'clock cutoff. That's from last week. From businesses like our retail groups, I've not heard anything other than the one that was Walmart. I know Costco has got some hours that are restricted, but they're not too far off what they've been operating on for several weeks now. It's the biggest change for them, I think, is the face shield requirement. You cannot wear a mask.
Excellent. I also see Brian Head on here, Lucy, Chantel, Lori, and Michelle. Thank you guys for hopping on here. If you have any questions for our mayor, please do comment it into the comment section. So our numbers have skyrocketed. It seems like from the last time that we had this broadcast until today. And I always, hold out hope that we're going to have some positive changes or news, but that I will still try and pepper in some positivity in this. So we are now aware that it's still isolated to the large and smaller groups. I know personally I'm seeing a little bit of a decline on the roads, but the problem that is persisting is that at-home gatherings, and this is something that's still positive because our businesses are not necessarily the ones that are at the top of where it's being spread. Is that still accurate, Mayor?
I think when you look at that, we have some elements of the business world that are in the top 5, but they're not the 2 biggest. We still see infections coming in from some of our restaurants. And I'm not necessarily saying it's the Westminster restaurants. You have to think about the reports are based on the county. So where in the county they're at, I don't know. I can only give you the numbers that we're getting. But we're still getting the same initial reports from both Adams and Jefferson County that 2 of the biggest contributors is the small group gathering. That's people, small groups less than 6, and large groups greater than 10. Those are still our biggest contributors and spreaders of this action. We have the capacity at the Water World of a little over 25, right at 2,500 tests a day. And from the last week to 10 days, they have been running full, 4 and 5 lanes of cars going through. As late as Saturday, I know some people that went over and went through, and it took them an hour. But an hour from start to finish is still not bad to protect your families. Mm-hmm. Results are coming back in about 72, 2 to 3 days is not uncommon. We had a group at City Hall that got exposed last week on Monday. They all had their results back on Wednesday. And very fortunately, we had nobody that came back positive. So that was very good.
That is really great to know, and I personally know they are quick to respond back on those test results. If you feel like you have been in contact with someone or feeling incredibly unwell to the point that you feel like you might have COVID, please go and get tested. We touched a little bit that we don't have necessarily any links, but I did include a link for folks here. I slid this in, and that's the free PPE that's still available between us and Jeffco. If you are a business that's anywhere in Westminster, you can access this: gloves, hand sanitizer, alcohol wipes, face masks, all disposable that you can have at your business establishment should someone come in not wearing items or that might need some of those sanitizing type of equipment. This is where you can access that. The link is dropped into the comment section of this broadcast. We do have a question that came through from Lori. This is related to Adams County. She's asking, so food insecurity has been one of our top priorities for Adams County. I know very early on we had several working groups. The city participated in that, chamber participated. We did a few different porch-like type programs across the city to help with the food pantry that was down there at Growing Homes. But this pertains specifically to Adams County, and the question is coming to us from Lori related to food banks that they may have. Are they still having those drive-through food banks? And she knows that at one point there was one over at the MAC, and if that is still going on. So 2-part question, whether it's from Adams County or if it's one that we are handling at Westminster. Do we have an answer that we can share with Lori, Mayor?
I was just looking on my calendar. Lori, I don't show one for this week. unless I'm missing it, we were still doing those at the Westminster Rec Center in combination with some of the food banks. That's the boxes that we were giving out. I can't tell you right now off the top of my head. I'll have to check and get back to Juliet. But I think that is still going on Wednesdays. And I know why it's not on my calendar, because I have the Dr. Cog meetings on Wednesday nights. So I think that that's still happening every Wednesday, to the best of my knowledge. But I'll confirm and let Juliet know. That's the only other one other than what Growing Home is doing, which is using the MAC. Again, that's in the Adams County portion. So I know that I also talked to Brenda Martin at Advent Lutheran Church. They had been doing food banks there out of the church, and they have stopped doing that except on an emergency basis. Everything they're collecting, and as a part of this is their congregation is concerned about COVID, but everything they're gathering, they are taking over to the MAC to add into what's being put together by Growing Home. But as far as the City Park one, I'll have to check and verify with Juliet.
Great question. Thank you, Lori, for that. We will be back with you with more specific schedule, hopefully detailed, so you can either share that out or let folks know. Mayor, we are getting close to our 30-minute mark. I know several people have hopped on toward the end. This was on a Friday, and I think it moves around. Okay, so there's one in specific, and we will have to look into that one in specific, Lori, because so she is referencing one that was on a Friday that rotates. So it sounds like it's a little bit different than the ones that we've been doing over at the rec center, but we will get back to you on that for sure. If there's anyone else that has any questions that wants to pepper it through, please comment it our way. And while folks might be thinking of that or are tuning in, Mayor, is there anything that you want us to be aware of? I know it's not council tonight, it's study session, and we are obviously, we have 30 days in this month, meaning that we have a 5th Monday. Anything else people should be aware about as it relates to council or city types of decisions that may be transpiring right now?
Well, there is, tonight we'll see a presentation on some proposed revisions to the oil and gas land use ordinance for Westminster. Keep in mind, we do not have any wells that are active or being proposed in Westminster. We have a copy of the draft sustainability plan that's going to be presented tonight. And as the staff is asking for direction on looking at the annual tap fee adjustment. This would be for tap fees. And after that, you'll get a more detailed report from staff and myself on the city's COVID-19 and what our next steps are. And there's some information, if you go on the website and look at it, there's the police chief community advisory panel, an explanation of what that is and what's going on. But I would add that if there are employers that have people that are not being effectively used on a 40-hour basis, and you're willing to see if they would become a part of the ambassador program, please let us know, because we will forward that contact information over to Tri-County Health and let them coordinate with those individuals. And again, the time you spend there doing this, it's paid time, and it's reimbursable through the city. I will hope that it can be reimbursable direct to an employer or to an individual. We have never looked at that, but it was something I was thinking of as we were discussing. We were able to get around a dozen employees who are doing this on extra time, but that doesn't mean that we have enough. So if you're interested, or if you have employees who might be interested, let us know. You can send it to me, that's fine, and I'll get it over to the appropriate person at Tri-County Health. So again, use my email address from the website, and we'll try to get you in contact with Tri-County. We are in the process of working on a very similar IGA with Jefferson County, and we hope to have that into the council here very shortly.
Thank you for that, Mayor. Good information for anyone that is interested in learning more, helping with that Health Ambassador program. Please feel free to contact the Mayor. His email is on the cityofwestminster.us page for you as well. If you just now hopped onto the broadcast at a later point in time and did not catch a lot of the information that was shared beforehand, please make sure you stick around for once it's closed so that you can rewind and rewatch, or rewatch it at any point in time. These videos are available to you in the video section of our Facebook page, also on our website, and of course on our YouTube channel for you. Make sure that you also do your part by sharing some of this information out to your network. If everyone knows about what's going on, then we're more mindful and aware the resources and just information in general that we should be knowledgeable of. So hit the share button on this video so others in your network can see it. We are close to our 30-minute mark, and with that, I do have to come to a close and let you know that we will be back here at 11 a.m. tomorrow talking about tips as it relates to water, especially during the winter months. We also have the Westy, Rise, and Westminster Chamber Dine Local partnership that we kicked off on Friday. That will run until December the 11th. So please feel free to go to our page, go to our Facebook page, and find out more information about the Taste of the Metro, which has kind of replaced our Taste of Westminster this year, so that you can support our local area diners and those establishments. Vote for the best, go out there and sample them, and bring that takeout home so that you can enjoy it with your loved ones. With that, I will go ahead and thank you guys for tuning in. And of course, thank you to the mayor for spending some of his morning with us.